On a kusha on a cabo, these are the Bɔdi Bεtẹ pass Gentri program. We na people that we don't learn boku come alone. Now them they give this program to una. We already give this program. We not only get paid, we only do them because we like the country. Today, na the 64th session, with the topic today, now an overview on uterine fibroid. We boku people that we come out now, we own type of country or we get we kind skin color black man, NTR can affect we, so it will be good for woman them for they watch and for let them learn. But also it's good for man them as well for land. The reason being, if you woman or you sister or you female person, they go through the NTR, they go finally you know, so you go understand the kind of support where you be able to give. But you also go understand what thing they go through. Today, na Sunday, the 30th of April 2023, and the presenter today na Dr. Christian Bell. My name na Temu John Fuller. Me not a medical doctor. Me a business IT consultant. I deal with IT and security and stuff like that. My own role na for make sure say them bookma so get away for them present to now without any hiccup. Okay. And the panelists then will get people within the team, and they will Bɔdi Bεtẹ Gentri team, and they go there for support Dr. Bell. So any question you want to ask, we must get somebody good answer because we get pharmacists, we get mental health nurses, we get emergency medicine consultants, the general practitioners, and Dr. Bell will explain to you now who that in be. And we get various people from various disciplines. Okay, so any question you want to ask, we must get somebody for answer. However, if I'm really big, if they say anything, not to say, then they talk about you directly. It might just be seen a coincidence because the program, we only give generalized advice. Not like for say, we're not going to give personalized advice, so, but the problem is we not get to the medical history. So because of that, we're not able to give personal advice. So they ask, say, do you if I'm with them? If you want to talk to me personally, then I will say take them offline. You have a discussion with the doctors. Okay. Another thing as well, fail for telling I will therefore mute everybody when the program starts. So we'll allow Dr. Bell like complete. We don't finish, we'll do enough time for them to ask any questions we will ask. Okay. So like I say, the people that we bring this program to now, we're not Sierra Leoneans. We only do which we can for help, we come together for help people them. Not all people no more in salon, but people that really right across the globe, but especially the people that back home, we know the constraints that we in the face. Okay, so whatever way we help, we try for help. We don't go now we know we don't run now for about 3 years. Okay, so the time they say we do on social media handles, so you can find me on YouTube and Facebook. Most likely I will try to get this program on Facebook today, so I will share the Facebook link. So for una way, maybe you get some side for you want to show some side, I can share the Facebook link. Continue to follow with it, or you can watch the program day later, or you can access them on YouTube. Okay. We also get a WhatsApp group. I will share the WhatsApp group number later. I will share the link so you know can join. Another one join, you can join. However, we join the group, you know, they will post. Okay. The reason why we could do answer now for try for stop. You know, people are not posting their way, not relevant to it in we try for do. Like what they say before, if you want to ask question, if you look, you will see 3 dots them now your phone. If you press them dots, then this page will come up. So if you want to ask question, you can use the chat and send a message to we or ask any question you want to ask in case you day one either you not feel comfortable or you not feel confident to ask question, or maybe also the environment too noisy, so you can use the chat function now. Okay, the other you can do, you can ace your hand up if you want to talk. The reason why they say for let people ace their hand up now for let everybody know they talk over in company. Okay, so you can use that function for ace your hand up when I see you, I'll count to you. However, if you know how we do all this, just ace your hand up physically. If I see you, I'll count to you. If I don't count to you quick, and not miss ignore, it just means I not see you quick. But once I see you, I will come back to you. Okay, I take your question. So now Facebook, now we WhatsApp number and also now we email address no matter how something fine, no matter how good take good, people they must feel say yes, there's a way for we improve, and we're not going to take offense to that. So they ask if we feel say there's any way we can improve, when I get in touch, but also if I get any topic when I feel say it will be important, although we bring cancer now, when I make that suggestion, we will try to see how we will able to do for bring that topic there too. Okay, I tell you plenty thank you. I will hand over now to Dr. Bell. We will take on through the session today. Thank you.
So let's share first. So now you see my screen now.
Now your skin will come up it.
Screen will come up it. My subspecialty in reproductive medicine and gynecological endocrinology. That means say they look after couples them we're not able for born picking, or women that were able for born picking, couples that were able for get picking. Then they are able for treat for making them go get the possibility for get picking. Then at Germany, I work in Germany and a fertility center, and now consultant also for Yares fertility consultancy in Sierra Leone. Today, I will talk about the uterine fibroids, or the uterus fibroids. I will first talk, define them, we'll talk about the prevalence, we will talk about the risk factors, then the symptoms, the complications, diagnostic and therapies we'll talk about, and most importantly, awareness for the woman there, especially within our own part of the world, in Africa. And after that, we'll talk about I'll give the take-home message. First, the definition. Uterine fibroids now growth or tumor where they in or around the womb, the uterus, the womb of the woman, and not to cancer. Yeah, make una know that. A lot of people can feel a cancer. Not to cancer, now a good tumor where they in or around the womb. Then also call them uterus leiomyoma. Lyo means smooth. Myo means muscles, and oma means tumor. So now smooth muscle tumor. The smooth muscle them are the muscle where they the uterus, where the womb, where they contract, where woman they born, for instance, or where woman they see in period. Now the most common tumor, gynecological tumor than the way they, but unfortunately we still don't know how this tumor how it begin, how it originates. They get some theories about it, but I'm not going to that part today because it will just confuse una. With the keep and basic and an oversight of the uterus or the uterine fibroids that they do. So on this slide, I also want to see the normal womb, like this, and this area also the myometrium, like the muscles, the smooth muscles within the womb. And then you get the cervix now at the end feet of the womb. You get the vagina, yeah, so now the man can penetrate, where they get sexual intercourse. You get the ovaries, then are the egg and the store, and then you get this we call the fallopian tubes. Then the fallopian tubes, then are the sperm, when the man don't ejaculate, the sperm move into the uterus, it move into the tubes, and then when the woman ovulates, you get ovulation. The egg and the sperm, they meet around this area, so, and then it can take like 100 hours for make the fertilized egg reach inside the uterus, and it attach at the wall for make the woman get pregnant. So now the process, and I don't talk about the more in detail. I mean, one for what I talk about, we don't do on basic reproduction. When I can go on YouTube and I can see that talk there as well. So if woman gets fibroid, when a fibroid we all know that's what we call them. If woman gets fibroid, like uterus, like womb, that's what they can look. They're not can get also all women they get boku. So woman get a small one woman they can get. So woman then they can get one big one where they out of the womb, or where they inside the womb, or where they inside the cervix. So woman then can get some boku like this way also, you know, and it gets boku thing the way it can cause. We're going for talk about. So you get the International Federation of Gynecology and Obstetrics. We classify them fibroid they also. They're number around from 0 to 7. So it depends on the location outside the fibroid day. Now they get number. So if it is inside the womb like this also, now 0. Then if it is out of the womb like this also, now number 7. You know, so that means say on this side also this one also with the out here so will be number 7. This one with the inside also will be number will be 0. You know, so now so then classify them for make people understand. So like if they do ultrasound or if they try for tell patients or for tell other doctors outside the fibroid and that the numbers are most likely to be used. You get some other names there where they can give them. We can also identify outside the fibroid and we can make things more easy if the people that don't know the 1 to 7 or the 1 to 7 are the classification there we they use now. So where woman can come to we present like this. This are woman where they on the theater table already. Yeah, this is not the foot side, this is not the head side. The way you see this woman, we cancel. If you cancel me in practice, the first thing way anybody will see this woman, so the first thing way they think, they feel say this woman get belly. But this woman not so belly gets. And the thing where it gets, when they're not open in belly, when they pull the uterus out, now distance. So we will not talk about that classification. That means all the ones that we see up here, so they're all are number 7. Yeah, this one also will be the number 6. The one that with the number 4, number 5, the number 3, number 2, you don't go see them because they were inside the uterus. You understand? So now this also then presents where they open the woman in belly, and this also then see. So not to begin, do ya not to reach. But we'll come to that talk day later. So when they operate that woman, they're able to pull all them fibroids also from the woman. We watch all them fibroids also from this woman. So they're even able to save this woman in uterus. And we watch almost fibroid come out. If you count them, are over 70. You know, so this also now an extreme form. Yeah, as I say, you get some woman there when a one normal get, but this is an extreme form for make for sure now how this fibroid can affect some woman. So, courtesy of Dr. Christian Bell Senior, and I'm daddy, he get in the 90s a woman, when a 27-year-old woman, we can in practice. He said the first time we see the woman, he said the woman on 50 because of the how the woman be look, you know, and then he see this distended stomach, feel say the woman will feel say pregnant. So woman can even can and they feel say they don't pregnant, they don't pass the 10 months, 12 months, 5 months they feel and still say pregnant. But then can hospital now, then find out say not to pregnancy. Although then they bleed back and they still feel say they're pregnant. So this 27-year-old woman, Dr. Bell Senior operated him and he removed this one old tumor. And unfortunately, he therefore removed the uterus as well because he not be able to save the uterus. And all this mass, now 7.5 kilogram weight. So just imagine almost weight for that woman there with the operator. And if you now watch this picture, so you go see one bulb with it next to this womb here. So then say woman in womb in size now like a bulb. It's small, so woman can get a smaller like a bulb, but we'll just say approximately like the light bulb. Then you go see the size of weighting this woman will carry now in womb, now in belly, all these years. Yeah, 27-year-old woman. Dr. Bell see this woman a few years later, healthy, everything okay. The only thing with this woman here, so especially this one here, so this case here, so the woman not going to forget speaking again. The first picture was shown now. In that case, they will be able to pull all them fibroid and the woman be able to get pregnant. So then say up to 50% of women them where the age where then they born begin, the reproductive age, they get fibroid. Yeah, you get some studies then they say you lower, you get some studies and say you higher. You get one study where a friend we talk say if you watch all womb the way they operate, any womb where they operate, then send the specimen to pathologists. All their womb then they wait if the pathologist check all their womb then they approximately 77% of their womb then they of their woman with their womb then they get fibroid. Some studies they even they talk say even a little bit higher than that. What are the risk factors? One main risk factor I just talked about are the age. Yeah, woman they wait at the reproductive age, that age usai, then they able for born picking, that then at the one risk factor waking we might them prone forget fibroid. And before I start with the risk factors, not so if you get the risk factor, that means say you will get them. But it just be say if you the people there we get when they around we get this kind of risk, there is factor there, so they get a higher probability for get them. Yeah, we talk about race and genetics. So that means we all know say we all sister them, we want black sister them, we want African sister there. The people that we get African descent, they get a higher risk for get them. If your sister or you mama, we don't get fibroid, you self get a higher risk for get fibroid. Woman there we not born picking, self get higher risk for get fibroid. And then we come to the hormones or the endocrine disruptors. If Pekin begins seeing period early, like by then 9 and 10 years old, they begin seeing period, instead get a higher risk, or the woman them we begin left for seed and period late. You know, woman can left for seed and period by the with the only 50, but we then begins left for seed and period by then 55, they go to 58, and then get a higher risk for get fibroids. Because we got for no say the woman hormone, I always call a messenger, the woman messenger, the estrogen, itself they help for make fibroid then grow. So that means physical activities, BMI, lifestyle. Yeah, people when they were overweight and obese, then get also a higher level of estrogen, and then get a higher risk for getting fibroid there as well. And then we get diet as well. There's people that we get low vitamin, or we get low vitamin or vitamin deficiency, vitamin D deficiency can get them. People that will drink a lot of alcohol can get them, or people that will eat a lot of red meat and low in vegetable, green vegetables and fruits, for instance, can also get a higher risk for get fibroids. My sister Fatima will talk about the diet later on after I don't give me on talk though. Waiting at the symptoms and the complications that we can happen. Yeah, you got to forget, like say some women them not can get symptoms at all. Yeah, and sometimes the diagnosis now by chance. Yeah, they go to doctor for something else for general checkup, then they find out say he gets fibroid. Yeah. Some women then can get symptoms, then can get complications, and then they depend on also who side the fibroid they, the size of the fibroid, and almost fibroid you might get. Then they say about 25% of women then we get fibroid, they actually show symptoms. And what are the symptoms then? Symptoms now heavy bleeding, or the period can also a bit longer. And if then they happen, they get anemic. They get anemic, then blood can thin, as we can say in our salon, and then can get iron deficiency. You know, and if they get iron deficiency, then get the anemic, then get always tired most times. But sometimes, because now slow bleeding, the body can kind of adjust to them. And when the body adjusts to them, when you don't reach some kind of critical level, now you actually notice them. And that is the problem with fibroid. People then can, if we don't go for treatment, then if it's oh, they feel fine, I feel fine. But then we actually check them, they actually still say they're really anemic. And sometimes the change to the critical stage can be too dramatic and too short. You know, so that's the one main thing that can happen: heavy bleeding, and also longer period. And then they can get distended abdomen, they get enlarged abdomen, and then they can cause pressure, and they can cause pain. They can also get back pain, and they can also get pain because sometimes if the fibroid don't big too much, it can degenerate. Or as I don't say, they get that number 7 or that 0. You can either see if it turn and the blood supply to the fibroid drop, itself it can cause pain because it degenerates, and sometimes it can cause infection as well. Some women them, they get pain when they get sexual intercourse. And sometimes this fibroid, they press on the bladder. And if you press on the bladder, then you get difficulty for emptying the bladder. They can get frequent urination. They can incontinence sometimes. They can run for going to toilets because they're not for old and wet. Or they can also get infection by the bladder. This is also in the area, the infertility and poor pregnancy outcomes. Women them, they can try to get pregnant, and then forget pregnant because of the fibroid, and sometimes they can get miscarriages where they get pregnant. The thrombosis and embolism. This we've talked about this here, so because this is so that the thing we actually sometimes can kill the woman them. Because if the fibroid big tumors, it actually stop the flow of blood from the blood vessels them or the veins them when they come out from the leg for kind of the heart. It can either slow that blood flow there or it can stop that blood flow there. And if you do that, the woman they build up blood clots inside the vein. And when you build up that blood clot there inside the vein, and small of that blood clot loose and begin move up, reach the heart or reach the lungs, and so they get embolism, and then a quick death. You know, so if any woman, because it gets fibroid, it begin get thrombosis. That means in leg they swell because the blood flow no they can up better again. And if they find out so you get thrombosis, a critical thing that they we can actually cause death if this thrombus, that's what we call it, loose and move up to the lung or to the heart. So now it make it very, very important for make women them go to doctor and treat themselves before it's too late. So when they talk about the symptoms them, I want to show now some fibroid them for me to understand with me. Yeah, like this one also with the up here. So I say if the blood vessel now so block off, if the fibroid turn and it twists and the blood flow stop, and this fibroid degenerates, it can cause pain. This also, these are the zero, we all know now. If the woman get this, and if it continue to grow big, and the uterus they try for contract, for remove them, the woman can get severe pain. The next woman can say, I get so much pain like inside the bone picking. Now because of this, especially if it dey inside in cervix now. So like this also we don't drop now, we don't kind inside the vagina already. If it inside the cervix, it can get severe pain because it can tell like I was saying the bone picking. And yeah, so back, woman them, if the fertilized egg reach inside the uterus, it can't attach. Even if it attach safe, you're not going for go fine. And if the woman go for get, it might get miscarriage. And if woman then get boku fibroid inside the womb like this, the womb not able for contract the way I for contract. And because if the woman is seeing bleeding, the womb get for contract so that the blood vessels then will be compressed so that the woman will bleed boku. But if that not they happen, the woman will bleed boku. So the reason that the woman then period can more than 1 week, or you can get heavy bleeding. Or if you get like this kind of fibroid here, so where they block the fallopian tube. This is the fallopian tube where I think that the sperm they move for meet the egg, and where the egg they meet for they move for coming inside the uterus, for coming inside the uterus, for attached to the uterus, the fertilized egg. If this fibroid they block this tube here, so then the woman's not going to get pregnant. So that the different things, the pain, yeah, the infertility, you know, the heavy bleeding, but then different way then fibroid has to cause them different symptoms. And as I say, it depends on the size, depends on the location, yeah, and almost fibroid the woman gets. How do you diagnose them? First of all, definitely history. We have to ask human questions. We have to know, very important for we gynecologists always, who say you see your last period, how long your period. So that means I always advise women them for always get a calendar with a mark who say you see your last period. because that the one question the way gynecologists always they ask, you know, who says your last period? And then definitely also how long you period, you know. So if you find out, say, oh, they bleed for more than 1 week, through asking questions alone, you don't get part of the diagnosis. And then you get the clinical examination, we also include vaginal examination, if possible. So if the woman are virgin, you can't do the vaginal examination, but you can do abdominal examination. You can watch the woman, like that show I showed now earlier, where the woman in abdomen distend like a dandy, and you know, say the woman are pregnant, you know, say, yeah, that could be fibroid. And they get the ultrasound examination where you can do abdominally if the woman are virgin, or you do the vaginal ultrasound, where for me more accurate, where they able for see the uterus more, able for assess the uterus more. But some uterus thinking so big that you know they able for assess them good with the vaginal ultrasound. Now, the one thing we can do at the MRI now to actually see how big it can, if it press on the vein they were being talked about. You know, MRI, very, very accurate. MRI can really show you the problem. And then you get the hysteroscopy and laparoscopy. Hysteroscopy, now where you take a camera and you watch inside the womb. You go through the vagina, you watch inside the womb, and the hysteroscopy and the laparoscopy, now where they watch up, now you come from up the Bεtε, so the navel area, you go inside with camera, and they aim for see the womb through the abdomen. So then one also, they use them for diagnostic, but they also use them for treatment. Because if you do the hysteroscopy, you see the fibroid inside the womb. You can able for, if you get the instrument for able for remove that fibroid inside the womb, you can able for remove that fibroid inside the womb. If you do the laparoscopy, that is the same thing as well. The treatment, as I say, some fibroids them you might not need for treat them because the woman they don't get no symptoms. Sometimes then fibroids also they shrink after the woman stop for seeing period, we go to the menopause, or sometimes even so during breastfeeding, then fibroid and also shrink. So that means say you can do the watchful waiting if the woman don't get non-symptoms. That means say watchful waiting means you get for to go regularly for examinations. Not of us say, oh, the doctor say a small fibroid no more than 2 centimeter, they not continue for go for checkup. If you go regularly for checkup, you don't need to go every 6 months, every year. Also okay, because not of us are not only concerning the fibroids, you go to the doctor every year. You get other reasons same way for the go to your gynecologist every year concerning breast cancer, for instance, concerning cervical cancer, for instance. You get for the go to your gynecologist every year. Then you gynecologist go to also monitor that fibroid day for see if they grow or they grow. Yeah, healthy diet and lifestyle, as I said, my sister Fatima will talk about that later on. But if treatment necessary, you get medications, you get non-invasive procedures. Non-invasive procedures means say they cut anything for go into the woman in Bεtε or anything like that, and they get minimal invasive procedures. That means a small cut normally you can for do, and they get the traditional surgical procedures. When it comes to the medical area, you get the hormonal and the non-hormonal. On the medication side, you get for no say first of all, in order they remove the fibroids, them might reduce the size, but in order they remove them. So especially the hormonal treatments, the hormone treatments, you can get one device, one IUD, where they can put it inside the womb, where they produce progestin or progesterone, and this also will allow for reduce the fibroid inside. The woman know they see period regularly. Sometimes at the start they'll get small spottings first until the body adjusts to that IUD day, and then they see in period anymore. Where it gets the IUD day. You get some IUDs and they where the woman still go to see in period, but the one where they recommend that the one where they release this progestin, and then they help for reduce the size of the fibroid. And then you get the gonadotropin releasing hormone them, get the agonist and the antagonist, then also medication, and some injections, some spray, and some tablets. The recent one in the tablets, the antagonist tablets, they will just don't create. Them kind of expensive. I know say that they might not be not be available in Sierra Leone, but it's very effective, and we they use in Germany now. So especially if women no want for be operated on. The non-hormonal treatments them, that one then actually in a temporary treatment. Them treatments them way not a long-term treatment. Yeah. For instance, the tranexamic acid, when they give woman then when woman gets a heavy bleeding, then they give the woman. So now only when they get the heavy bleeding they give, and not to permanent treatment, because this medication also they cause thrombosis. So just imagine, woman gets big fibroid, when they press on the vein, it still gets heavy bleeding, and then you give this medication regularly. Now they go actually build that thrombosis stay, and we could also give them embolism, and we could even kill them. So I'm saying the therapy can even kill them if you not take them. So it will help temporarily for stop heavy bleeding, but not to the permanent treatment standing. Also, other medication like ibuprofen can also help for reduce the bleeding and also reduce the pain, but not to temporary, not to permanent medication, because they make medication and this and then like ibuprofen can also cause stomach pain as well. So we got to take care who they prescribe patients their medication there, or them people that we can go over counter and go get then kind medication, and they please not to permanent medication there. Because of okay, as I say, some studies that show say women that we get vitamin D deficiency can also get a higher risk for get fibroid. So they can say, okay, can find for give women them vitamin D supplements them. I put question mark because it's still questionable. And iron, definitely, if woman anemic and it gets low iron, you get for give iron. But all the treatment they are so now actually not just supplement treatments them, not to treatment them where actually they cure the woman. Yeah, and the hormonal treatment, as I said, not only treatment that will reduce the size of the fibroid. And then you get the non-invasive procedure. One of the non-invasive procedure is MRI guided focused ultrasound surgery. The woman they lay down at this MRI bench, and then you get this ultrasound generator where actually they beam ultrasound directly on the fibroid, like it kill the fibroid, you know. And you can do that day per woman they will not get multiple fibroid. You can do them per woman they will no want for operate, but some people then say it can cause pain, especially when the fibroid will degenerate. It can cause pain, not all time, but sometimes it can cause pain. But then one effective treatment if you know for be operated on. You get two other minimal invasive procedures that I will just mention slightly. We know they do that much, even in Germany also, where you actually block the vein them, where they go to the tumor, to the fibroid them, and we block them vein them, or block them blood vessels that they where they go to the not to the vein, the blood vessel where they go to the fibroid, it will cause the fibroid for degenerate. Then itself can cause pain, but we don't degenerate done. They can okay, but sometimes some of them can also get infected. And unfortunately, it's now a very expensive treatment as well. So we need to do it on a regular basis. Same thing with this radio frequency ablation. You go through the abdomen, and then you actually kind of burn the fibroid. But as I said, then two treatment there, so they need doing that much. The one way they can actually do now the laparoscopic and hysteroscopic myomectomy. Myomectomy means they remove the fibroid. Yeah, laparoscopic, as I don't say, You go through the abdomen like a yaso. These are the laparoscope, the camera where you go through, and then you get your instruments, them where they're able for operate with. Sometimes you need 2 or 3 holes them, but they're still minimal invasive. I'm saying, you know, they cut the human open. That was we can call them a key lock operation, where you go in and then just remove the fibroid. Or if the fibroid is inside the uterus, so they can have number 0 or number 1, you go through the vagina, through the cervix, and you go into the uterus, and then you remove the fibroid. You get what we call mucilation, and that is really contested. Mucilation means that when you do this minimal invasive procedure, especially when a small old day and you get some big fibroid, you cut the fibroid small before you pull and come out. Sounds like a very good method, so that you don't need for cut the human open for pull the fibroid, but sometimes you don't know if that fibroid is a fibroid. Yeah, it could be say not to fibroid, it can be so now what we call sarcoma. Sarcoma is something like a cancer which can actually spread. So if you cut that fibroid or that mass inside the woman in abdomen, you can send cells them of this sarcoma all around the abdomen, and it cause this sarcoma for spread, where they actually will kill the woman after a while. You know, so that it was really contested. Some people then they advocate not for do them anymore. We say no, they do them. You get another way how you can do them, where then you get like a bottle, like a plastic when they put inside the woman womb, and then they put the fibroid inside that plastic and then inside that plastic now they cut up for pull and come out. But as I say, it's very contested. For the medical people that were amongst me, for make them know that they are swell. But then the one way, if the fibroid is really big, or they get multiple fibroid, like that woman that picture was shown now, what they can do is they can do the abdominal myomectomy. That means they cut the woman down in bottom belly, either they cut and sew, or if the uterus and the fibroid really big, you can cut them from up and down, and then you go in, you remove the fibroid, you can pull the one uterus out, and then you pull one fibroid after the other. Or if you need for pull the fibroid, because you know, so if you sit down and you pull all the fibroid, because you get for really be patient for pull all the fibroid, but sometimes women can start for bleed profusely. You get for notice some of the women in the HB or the hemoglobin level so low already, that can cause complications if the swim and pull all the fibers a day. If the woman can bleed and then not can go, so some surgeons that can decide, say, okay, we get for pull the uterus, and then called hysterectomy, removal of the uterus. And at this also, a lot of women can fear. A lot of women can fear, say, oh, if I lay down na the operating theater, before I wake, they're gonna pull me uterus, and me don't want that. So now I make the knock you want go to doctor, they're not for me for the knock you want go for treatment. But that's very wrong, yeah, because sometimes it also depends on the size of the fibroid and on the size of the uterus as well. You know, if the size is not too big, then you can do it laparoscopically. If the size is big, then you can do it abdominally. But as I say, that woman, you see that woman when they pull 70 fibroid pan, they're still safe in uterus. So then they're possible. So these are all the treatments, and some of them are not talk about them. But these are most of the treatments they will do: the surgical treatment, the hormonal treatment, and the non-hormonal treatment. And as for where I know, the one that with the arrow, that the one that we available in salon at the moment. As I say, that one there, so this tranexamic soil acid there, so now temporary treatment, please, at the repeat standard, it just they reduce the bleeding. You know, you do nothing to the fibroid, it just they reduce the bleeding temporarily. Yeah. But then for remove the fibroid, you get for do the myomectomy, That means say either laparoscopically or the open surgery. And if you don't so big, you therefore do the hysterectomy. That is if they salon. Oral contraceptives can help for control the bleeding as well. You know, and the IUD, I think that the IUD safety salon. But then it is MRI, this high frequency MRI guided focused ultrasound surgery. And also, you know, this salon, but I get for talk to one of my colleagues, one of my friends in Nigeria. He own a clinic, Nordic Fertility Center, and the Nordic Fertility Center, they offer these treatments in Nigeria. So if you now want, if you want to get more information, you can contact me. So the most important part, awareness. Yeah, the one thing for we Black sister them, for our African sister them, we therefore know say, the fibroids, they are una Black woman is 3 to 4 times more likely for get fibroids than the white woman, the European woman, the American, the white, the Caucasian woman. Yeah, and Black women them more likely also forget multiple fibroids them as well. And unfortunately, although in sub-Saharan Africa we get the largest population of Black women, now they get the least amount of publication, amount of studies, yeah, concerning fibroids, and that's really sad. You know, okay, things can improve now, small, because I read some studies from Ghana, from Nigeria, from Kenya, but the most studies them Europe or America today. The one study was in America, they show say over 11 million women be affected from fibroid, and it cost the US economy approximately $34 billion yearly, annually, every year. You know, so now something will actually also affect the US economy. And then say then diagnose close to 70% of white women them or Caucasian women them with fibroid, and more than 80% of Black women by the age of 50. And then say the incidence of the clinical symptoms, the symptoms, them Black women double more affected with the symptoms them than the white women them. The studies that were found for Africa, get this one from 2022, where they say they actually get a lack of robust studies them in Africa concerning the fibroid them, sub-Saharan Africa, and that's then they request an urgent that say there's an urgent need for that study there in Africa, because now the fibroid them are the most common gynecological tumor in Africa, and also women in Africa where they die of fibroid. And that's really sad, because honestly that's something that they way women not supposed to die of. And we actually find out say also in the Western world, now then they happen also to the Black sisters them, where they get major complications of fibroid in the Western world as well, because then they actually afraid for go to doctor. You know, so but in sub-Saharan Africa, the problem with I find this another study from 2019, where they say some women then go get successful pregnancy and successful delivery, even when they get fibroids without interventions, but some women then they'll get nightmare and they get significant negative impact in their quality of life due to lack of knowledge, lack of access to care, and late presentation. Yeah, and that's the big problem. Yeah, and I make women in they die of fibroid in Africa. Yeah, I will repeat it so over and over again for making it go down in the awareness where people are for known as Africa salon in Africa. You know, and say from their own experience, most women they go to prayer houses or they go to local herbal doctors them or the local herbalists them, and then people they can get good intentions sometimes, yeah, but they are untrained in fibroid management. They're not able to, they could complement, support, maybe, but they are not trained for treat fibroid. So due to that, and due to the complications then we associated with that poor disease management, boku women then unfortunately they die daily in Africa. So what do you do? If you get an enlarged abdomen, if you get heavy bleeding, if you get abdominal pain, if you get if you suffer from infertility, please go see a specialist. The religious leaders and the traditional healers, they can complement the therapy, they can support you at best, you know. But we know say so women they know they go to doctor because they're afraid for make them lose their womb, make them afraid for go to doctor. But in the worst case scenario, it's better for make you lose your womb than you lose your life. So take home message. Fibroid, they now growth where they in and around the womb and not to cancer. Up to 50% of women them where they around the age where they born picking. Now then get them, now then suffer from them. Risk factors them, age, African descent, overweight and obesity. Now make diet very important as well. Family history. If somebody in the family we don't get them before, that means you might also get them. Diagnostic include also clinical examination and imaging. You know, we know so we get ultrasound now in a salon, but at the hope say we also get qualified staff them where they do the ultrasound in a salon. We in Germany also the gynecologist and we do ultrasound. I always say the gynecologist and then they treat the disease, and then they help for manage the woman, and they help for talk to the woman. So it's always fine for me the gynecologist also do ultrasound so that they will see waiting there for treat. You know, yes, it's nice for get a result, but sometimes ultrasound, especially ultrasound, a dynamic diagnostic, or to picture you they watch and they do diagnostic, a dynamic diagnostic. So that means that the gynecologist, I can always, if you say, okay, you get a sonographer, I can always say, okay, well, let the gynecologist go to the sonographer, watch with the sonographer, they do the ultrasound, so that INSEF will know exactly what they deal with. Yeah. So there is no one fits all treatment for fibroid. You have to go to a doctor for make a doctor advise you whose treatment option go better for you. And we need more awareness, more education, and more studies in sub-Saharan Africa, especially in Salon. And my last statement I will give, we're very important, as I said, and I will repeat them over and over and over again. Go to your specialist for proper diagnostic and proper treatment before it is too late. I thank you for listening. If you want to contact me, you can contact me through ARS Fertility Consultancy. This is my website and this is the email address. I mean, the consultants or the specialists where they advise patients them on fertility issues them, or when I can go through Bɔdi Bεtẹ past Gentri, because as my brother don't say, when I can write me an email and we will get back to Ona. Thank you very much. I hand over back to Mr. Fuller and Ms. Sister Fatima can talk about nutrition.
Thank you very much, Uncle Dr. Bell. Dandanabi, brilliant presentation. I really learned beaucoup. So first of all, Nadande, I just want to let you know. But yeah, so in terms of the nutrition, the advice where they're around now, of course, now really not the basic kind of advice within the normally give, you know, so therefore eats beaucoup vegetable, fruit them, you know, make sure that they get on a variety of balanced food them like so. So then they go able for, manage the symptoms then, but also it go able for stop the growth or manage the growth of the fibroid, because as Uncle Dr. Belby don't say, estrogen, the one thing where they make the fibroid they grow. So if they're able for manage the food them where they cause that estrogen for rise, then it go able for manage the growth of the fibroid as well. So that's the most important thing. Now back now, how don't Uncle Dr. Belby don't say Boku woman then now the Black community then gets vitamin D deficiency. So Boku research they don't do Boku research where they show say now then there's some time at the kind of the cause where they actually exacerbate, where they make the fibroid they grow more, or they also give you the risk, the higher risk for the fibroid for form back. But also them say also vitamin C and calcium also, and now something where Black women then gets high deficiency per. So then they also then think say can cause that actual growth of the fibroids back. So within then they recommend say when they specifically for the for Leona prevent them more than anything, then they say women they eat yogurts where high in calcium, which go reduce the risk of fibroids. So then they say not so for where you don't get them, but before you get them, so sometime there during the time where they begin for see menstruation, say you get that history in your family, then it really recommended say when I for try to get these food them. And I know say in our community we know they eat beaucoup dairy foods them, so dairy foods then like yogurts and things like, so we not get them beaucoup now we the food them way we they prepare, so say plus us we know they put no dairy panam beaucoup of the food them way we they prepare no gets dairy, so now makes then they say good for Black women then they begin for incorporate this then diet, because the dairy products then they allow the normal bacteria na the Bεtε, okay, so the probiotics, prebiotics, where they help for balance the bad bacteria and the good bacteria, where they help for reduce inflammation back as well. So now make them they recommend and they. Now, the other thing very important, not only the diet, but also for lose weight through exercise. So as well as the diet, when I did for remember say exercise also go able for help the fibroid symptoms the way we experience as well. But also when we go back now the food, antioxidants, which now the compounds where they reduce oxidative stress. And oxidative stress, it means say they produce things then like free radicals now with body, and if these free radicals then they attack we cell them, so they cause cell damage. So in fibroids, of course, the problem where they happen, like Uncle Dr. Belby don't show we so now then they cause the fibroid for form that cell damage, they cause the fibroid for form that tumor for form. So the antioxidant food them where you go able for eat now food them where high in vitamin A, vitamin C, vitamin E, all then get antioxidant properties where then go reduce the cell damage. So then they also now preventative measure, but also a way for for reduce that cell damage, so you go reduce that growth as well of that tumor. So some of the foods that we go able to forget were high in vitamin A, so 10 liver. So I know say we they eat beaucoup liver now we cuisine, but if we know they eat them, try to incorporate them. But also all other kind of orange colored fruit them and vegetables. So like pawpaw, as you see, it gets that orange color. It means say it gets carotenoids, which then the turn to vitamin A. So that color where you see the orange now because it gets high carotenoid, we go able for transform into vitamin A. So then other thing where I recommend for people for try to increase these different type of fruits them and vegetable where it gets that orange color because it gets high vitamin A. But of course, other fruit them and vegetable then gets vitamin C and vitamin E. So we don't talk say guava, now one of them. But as we don't say, if we not eat a wide variety of of these vegetables and fruit them, you go able for get all these antioxidants and vitamins where they're able for, reduce that inflammation per the fibroid as well. Now, even so, Uncle Dr. Bell, we don't say about vitamin D, for say, it gets some sort of therapeutic level where they're able for help the fibroid, but a lot of the research where they're out there, it's not too precise. So we're not able for, really see safe, now then they're able for reduce, and specifically now we Black woman then. So we need to forget more research for say whether if they take that supplement there, it could reduce the growth of the fibroid. So that then there. One other thing that turmeric. So I don't know if when they use Boku, and also Boku Indian, then they use turmeric, but turmeric get this property we called curcumin inside, and Boku research then don't do them, and they show say they reduce the size of the fibroid. So I'm not say if they get rid of them, none of this advice where they give, not going to get rid of them, but it could help for maybe reduce them as well. Now green tea as well. Now other thing we say they bring down the high estrogen levels. So it could reduce the inflammation, because if you get the right balance, it could reduce that inflammation as well. Now the other thing as well, now healthy fats. Okay, so the oil way with the cook with, so coconut oil, olive oil, palm oil, but all in small amounts. So nothing saying a boku amounts now and they for use, but that small amounts they reduce again the inflammation because of the omega-3 them way they inside as well from the sorry, not omega-3, sorry, the unsaturated fats way they panam, so in a good fats way when they reduce the inflammation. Now the other thing, now fish, okay, fish gets good omega-3, so sardine them, mackerel, herring then, all them thing then they could reduce the inflammation. So then the other thing where I go advice for Leona increase now in our diet. The other thing as well now the fiber, so the fiber and the carbohydrates where they eat. So if they try for get more of them complex carb them, so like oats, brown rice, legume like beans, peas and lentils, then get high fiber. And then the reason why then they recommend from we increase down there now, because the fiber they bind to the estrogen compound, so it goes stop and for let go back now with bloodstream. So as we don't say, estrogen they cause that growth now the fibroids. So if you're able to reduce the estrogen and balance them, it go able to stop the fiber for grow back. Okay. Now the other thing, the way we differ then think about now the thing the way we differ avoid. So a lot of research done show say that soy products, because they get one property which now isoflavonoids, which they act like estrogen. So the compound they mimic estrogen. Okay, so when they eat soy products, so soy products, normally we know they eat them boku na we community na more than Japanese, but I know say some other food them where we sometimes no say we don't know if it gets soy inside, then it's really important that we understand whether it gets soy, if with the eat them, because then they again go increase the estrogen. The other thing where Uncle Dr. Balbi don't say now red meat. So red meat again is something where we therefore reduce. Now the reason why then they say that then because normally the animal then they get then the food way then the ghee then gets it gets soy. So sometimes na make night then they say let we avoid red meats, because the food way then the animal then the ghee now then they cause the high estrogen per the meat. So now make them they say for reduce down there. The other thing of course now reduce the processed foods, thing the way gets high sugar, but also not they eat too much carbohydrates, so not too much rest, because then they again can increase the insulin, it increase the blood sugar now with blood, and then they then don't prove say they affect the hormones, so it could affect the level of progesterone and estrogen now we body, and we know say we African diet high in carbs, so we therefore manage try for balance the two well, but overall the most important thing now antioxidants. So where would they get from? Vegetables and fruits. Okay, so but specifically fruit then, you know. So as I don't say, pawpaw, things like so I try for increased stand there. Some of the other things then, as I've done mentioned, turmeric, green tea, fish, like so you know, a well-balanced diet for manage these symptoms, but those specific things then be done show say it gets really good kind of benefits for reduce the growth of the fibroid, but also they reduce the inflammation, so the symptoms where they get. As I say, avoid high fat food them, think them way fry and high fat, high sugar and high carbohydrates. So nadan de normal. So thank you, and I thank you.
Okay, thank you very much, Auntie Fatima. Dr. Bell, thank you very much. I'm sure people don't learn a lot. This issue where you talk about so today, a lot of we, whether a man or woman, or either for the woman they don't suffer for man, or we know somebody, we don't go through them, or way they go through them currently. And somebody meets them where Dr. Bell don't touch on, I think then we all, well, most of we, I believe, don't hear it before. I hope say don't answer most of the question in there. Well, in case you answer the question in there, or you feel say you need more clarity, feel free to ask question. The reason why we do this in KRIO now for not to say we simply don't understand English language and go meet the doctor, but we do them in KRIO for let people feel comfortable for talk the kind of language we all understand. We don't talk from way, you know, before even Bobby and what's and they would on the hear. Because of the way we can go meet doctors them as well. We don't try for express things. So because of they don't tell we already say we get this thing. We mind not a day on anything. Always the person they talk, they pass here, come here. You only to they focus now on oh Papa God. Which don't do me so. So because of that anxiety, they sometimes they will not pay attention properly to what they say. So it's an opportunity for we will not go through them, follow ask more questions. We will not go through them, it better that we know more. Recently I go see a doctor. Now the guy asked me if I want to go through the full MOT. Now I say yes. Now I say, now the guy look at me, now I say, yeah. I say, better I know. The sooner I know, the better. At least if I don't find out here now this I get, there's no whether I decide not for no, it goes still did it. So better I know, able to understand what you don't do me, and try to put plans them in place for how for manage I'm going forward. So at least I'll be able to spend a couple of years, you know, with me loved ones, and then I decide to say, I know. I made that carelessness, I turned me back away. Yes, maybe I will live another 10 or 15 years, but who knows? Make sense? So they are the ask if I get any question for us, gonna ask. The first one I go to Muriel Samuels. I don't know if you still want to ask a question.
Yeah, sorry. Thank you. Dr. Bell, you can talk about what's in the happiness. I think Sabine focused specifically on the progestin, the IUD, and what's in the happen way if person still get Bẹtẹ, if you take any of the treatments and specifically that one day and the other one and stuff, you can touch on the other one and stuff. Thank you.
Yeah, if one gets pregnant again, first of all, it depends on the size of the fibroid. Size of the fibroid, location of the fibroid, and how much fibroid you get. So we now also in Germany, if you get a small fibroid weighing like 2 centimeters, if they're out of the uterus, you did like number 5, number 6, number 7, and we know so that they can actually affect pregnancy. Yeah, it could affect the contraction of the uterus in some way, but normally small fibroid not they affect pregnancy. Only if you get the number, if you get the 0 and the 1. Now I don't know about that now, so I can call the number there. 0, 1. That one then they can actually affect pregnancy, especially if they're large as well. If you get the 0, for instance, then they definitely get for pull-up. They get for pull-up, even if not 2 centimeters. Yeah, because if you sit on inside the uterus, then they get for come out. And then if you get like the 1, some people can say, okay, pull-up only if you don't get miscarriage before. But if woman don't come to me, you know, they try to get pregnant for like and then 2 year, 1 year, 2 year, then I can advise and say if it's not 1 or 2, decide this location also a day. Then I'll advise them for pull as well. If woman then no one get pregnant and then get symptoms and then get fibroid them when now 4, 5, 6, yeah. If they get fibroid like then 4, 5, 6, 7, and they get symptoms, then you can do the IUD. Yeah. If you get like then 0 and 1 and you put the IUD inside, it might not be effective like I4B. It can also dislocate and move out as well. So if like 0 and 1, like you say for the move, that means if you don't get pregnant and you get symptoms, then that one they also have to remove. But if you get like a 3, 4, 5, 6, 7, and you just get symptoms, you don't get pregnant anymore, then you will get the IUD. And you can also get progesterone tablets, them like a contraceptive. We don't get estrogen, we not only progesterone they get. You can use that, the woman can take that as well, and they can comfortable with that as well if they don't get pregnant, because when you get that, you know, they see period at all. And interestingly enough, now the treatment and the back for endometriosis. The last time we did talking about endometriosis, I can go back on the YouTube channel, and you can go watch that on the YouTube channel, and it's a full on talk on there as well. That's all we talked about again. I also do on the YouTube channel, so I can go back on it and watch them. So that means, as I say, 0 and 1 with symptoms or infertility, then get for remove them, then the IUD not the work under. And if woman gets pregnant, then IUD, IUD, I know advice woman forget IUD. And then most of people that work they come back, they can present at the age of, they can come with infertility at the age of 37, 38, going to 40, where you know, so the pregnancy rate don't lose it already, you know, so that you can't wait for reduce the fibroid. Yeah, if you get possibility for remove the fibroid, you get for, especially as I say 1 and 2, can remove the fibroid. If you get fibroid, we think okay, this also might they block the tubes, you can also remove that fibroid there as well. But women within the age, then they one gets speaking, depends on the side, the location of the fibroid, then you will decide for the operation. Or if you don't get speaking, or you say I still get small time, I don't know it, I get speaking, but I get symptoms, then the progestin, IUD, or contraceptive, a great option.
Okay, thank you very much. I hope that will answer your question. Okay, Muriel, I will come back. I'll come to you in a bit. I'll just finish with Muriel, please. Yeah. Yeah. Muriel.
Okay, so yeah, thank you. Can you hear me?
Yeah.
Yes.
Okay, Dr. Bell. So I will make you thank you for that response. I will make you clarify for me the treatments themselves. What's not the risk of how then they affect the risk of you know, if you want to get better later. So how then they affect that risk there? So you say IUD is like, so like if you can go through them, please. Thank you.
Most of the, if you say okay, you want to get your IUD, for instance, and you want to get pregnant later, okay, that's in every treatment you get risks. For instance, the IUD can cause infection. For instance, I mean, it's risk very low, but it could cause infection. But usually, and so IUDs them, they actually left in for about 5 years. Some people are keeping it for longer, and it's kind of practical. If not tablet you take, you go take the tablet every day. You're not supposed to forget the tablet for take her at the same time every day. You know, that's it. So women, if they know, I don't call it discipline, but person they forget, you know, and then can function the way it's supposed to function. Then make a lot of people then can move in for IUD. But the risk factor for IUD now, for instance, infection. For the risk, there's no risk, not heavy risk factors of the tablets. So women then can get, they can take a few months few cycles before they begin seeing a period properly, but then they affect pregnancy at all. And then also the GnRH, the tropin releasing hormone, agonist and antagonist. Like if you get the injections, then get some injections when 3 month injections, you get some then 1 month injections, then and say after if you want to okay, well, I ready to forget Bẹtẹ now, and it could take a few months before the cycle can come. But apart from that, it's not supposed to affect the pregnancy. Waiting they affect the pregnancy most times now actually the fibroid. Now actually the fibroid, especially as I don't say the numbers, the 0, the 1. And if you get multiple fibroids, and if you say, okay, I don't want to forget Bẹtẹ now, but I want to forget Bẹtẹ later, then yes, you can do the IUD and the progesterone. But if you get the 1, the 0, 1, then I will advise you for put the IUD. And at the end, and in women, them we don't reach age of 38. I don't see any reason why making for the weight anymore. And I say no reason for weight. Okay, yeah, on the born picking side, yeah, you get people there and get other things that we get for do, for study, they get for open a business or do something. But on the reproductive side, where you don't be age 38, they go 40, your pregnancy rate don't get below 10% most times. And we get the fibroid even lower. And when they talk about pregnancy rates, we need to talk about live birth rate. Because the live birth rate is lower, that means that you can get pregnant, but you can still miscarriage. And you miscarriage rate at the age of 38 going to 40 also higher. So I advise any woman when they reach then 38, they go 40, that you're not supposed for weight if you still get plan for a pikin. I don't get patients them with them when they're over 40, they go 42, 43, with the frame for go operate, get big fibroid, they're afraid for go operate because they still want pikin. Yeah. At that age, people will say, oh, but I want me paddy when self born away 45. First of all, you don't even know if my egg use. You don't know. I know say we always in the gynecology we always talk about probability. So the probability for make a 42, 43-year-old woman gets pregnant and born pikin lower, way lower than person with 30. Yeah. So if you don't be reached their age, then there is no reason for make you wait. Go to your gynecologist, make them go assess you, see whose treatment good for you for make you able to get pregnant as soon as possible.
Okay, thank you very much, Dr. Bell. So they go now to Auntie Isata. Isata?
Yes, I'm here. Can you hear me?
Yeah.
Loud and clear. Welcome.
Thank you very much. Thank you so much, Dr. Bell. Thank you so much, Fatima, for this very informative session. My question to you, Dr. Bell, is that given the propensity for race, the genetic probability for Black women to have fibroids, is there a preventive MOT that package that can be done when one is getting to that age, or if anyone gets that some of the symptoms where you highlight? A case in point, you spoke about the effect of BMI, body mass index. You spoke about vitamin D deficiency. You spoke. There's also high estrogen. There's also potential for hyperparathyroidism because of calcium depletion. So what I'm asking is, because of that, is there a package when a woman wants to go and do an MOT around the fertility area that you can prescribe that one can do after a certain age, so that we can use this as a preventive measure to also, when we're doing our MOT, our hemoglobin, our this and that, we also have that package ready, just so that we do not go when it's at a later stage. Thank you.
Actually, as Fatima said, we don't say, first of all, healthy living. Healthy living, diet, balanced diet. Yeah, and Germany has like always talk about this Mediterranean diet. Get somebody that the audience will also talk a lot about the DASH diet. Maybe go one for say a few words about that as well. But healthy living, exercise is very important. So a lot of people can always feel say, okay, we need treatments, but we don't actually need treatment. Also, when they get vitamin D, when they get vitamin D from the sun, and I can always say, Black people and people like always the one that way at their Germany also we sun the shine on the place, so they say, you don't use some. And I say, we feel for realize Black people are the people that we actually hate sun. Yeah, you need to see Black man, they go on a beach, they go live on a beach, they go do sun time. Yeah, so we cover ourselves a lot. Yeah, they avoid sun a lot, even in Africa, and when even in Europe, for instance. Okay, with sun not there that much. With Sunday is also the avoider, So now one thing that I would advise, especially people for do go regularly under the sun. I mean, if you go shirtless under the sun, and obviously even sleeveless is enough. And waiting you they get from the sun like a daily dose. Not of us say you go to the sun, you say okay, they go up the sun from first of all a naked 12 hours. And then they don't do for the next 3 months. No. A daily dose you get, so you get for going on this one regularly, then they enough for vitamin D. You don't need actually supplements. The only supplements where people then can advise for women there we want to get pregnant or we're pregnant, folic acid and iron, yeah, especially in Africa, iron. So yeah, the treatment or the waiting the package will support for the terrible patients now. Please live healthily. The advice way Fatima don't say. I don't know if Fatima will be able for write them down and post them for make people know that they and Fatima don't give a lot of talks about diets and nutrition. If we're not going on the website on the YouTube page, we're not going for go through them sessions then there as well, and we don't talk a lot about the thing as well. So I will say there's a medical package where you can give people them, but if somebody don't get fibroid, then first of all the doctors go for the observer, and if you don't infertility or sort of infertility with the class and say if couple don't try for get pregnant for 1 year and then get pregnant, then definitely we'll see how that fibroid they affect pregnancy. We know also for whether they're side by now. We know also for get demand them, for let demand and say could check for make sure it's not to be demanding in semen and for example the semen analysis for make sure to demand sperm count. They cause the woman infertility as it so we get for the as well. But first of all, lifestyle, exercise, make sure so you're not overweight, good nutrition, folic acid, iron, and if you get fibroid, specialist for monitor your fibroid, and it will assess you for see whether for operate or not. Over to you. You mute so.
I thank you very much, Dr. Bell. The bit about the sun, I don't let me down. Maybe don't go black extra. That even don't do for me for the end of the year.
Unfortunately.
Galaxy S9 Plus, you will get for introduce yourself before you talk, please. Yeah.
Hello, good evening. Can you hear me?
Yes, live and clear.
My name is Nafi. Nafi Sumari. I get, first of all, thank you to Dr. Bell and Fatima for the very useful presentation. I get 2 questions for Dr. Bell.
Yeah.
The first one is about the blood clot we mentioned for women that can get fibroid. Is there a way that can be prevented? I know say not all every fibroid is need treatment because some then we know they give symptoms, then nothing needs to happen in terms of treatment. But for the one that they're at risk, way they for prevent the blood clot, because obviously toxin activity can be fatal.
Yeah.
That's not one question. The second question is, you talk say I think high level of estrogen or progesterone, one of the two hormones, they actually cause fibroid. And I know say some contraceptives medication then hormone then they. Does that mean women where they take contraceptive, they're more likely for develop fibroid? Thank you.
Yeah, thank you for the question. A very good question. The first question, I'll start with the second question. Yes, you get contraceptives that will get estrogen in them as well. Women that will get fibroid, like I advise them to take down. You get the progestin or the progesterone, one them, gestagen, one them. We are Germany, we call them gestagen only contraceptives. That one and they immediately advise patients to take. We get fibroid, and as I said, if you take it regularly, and if you see they take at 8 o'clock morning every day, 8 o'clock morning, for take enough for forget it. And then they actually prevent the woman for seeing bleeding, and it actually prevent the estrogen level for increase, and through that the fibroid they decrease. Yeah, that's not the second question. The first question, I think, is
about blood clot.
Yeah, the blood clot. Unfortunately, they not very seldom thing that. Yeah. Okay. Now, when the fibroids don't big tumors, they don't big tumors, and then you get them blood vessels. You get the blood vessels, the vein them where they come on at the leg them. They can't up. They call it iliac vein them. They can't up now for can join and meet the one big vein within the middle when they call vena cava, and the iliac vein then you get two of them, yeah, on both sides, internal and external. So, but then and if you get this normal flow where they happen, the vein. So if the fibroid that's big, I mean, we're talking about the really big fibroid. That picture was shown now where we get a 7.5 kilogram. Now that I can see at the top box. Then they now can compress the vein. Women then were pregnant also get a risk there as well, for instance. Yeah. Then maybe you see some women then back when they're pregnant, they can get swollen legs them as well, but okay, get other things where they cause them as well, where they call eclampsia and eclampsia, but a different area than they now. But then it can happen. And if that they happen, and the blood flow slow, and then the cause for make the blood clot form. So that means, say, I mean, you suppose for don't go to doctor before you reach that stage there. Yeah, and if you reach that stage there, you can find out, say, it's very critical. Then kind of woman in there, where you watch the blood, where you watch the HB is so low because that mass day, the amount of blood with that mass day they consume, then a one. And secondly, the heavy bleeding with the woman don't get that thing to see will not happen 1 year. That thing we don't take years for develop that kind of way. So that I make I put a last say that's most of the emboli. Then now we don't reach that area where so woman don't say no, and then they go to doctor they reach that stage there. But me the advise woman them for make them go see the specialist before it reach that stage there. Before, and it's very important, before you reach that stage day, you suppose for don't go to doctor. Yeah. And as I say, it's possible, say you go lose your uterus, your womb. It's possible. But you know what die. And then the main thing, you know, and some woman then they always feel say, if I not get womb, that means I mean to woman again. Then they not to true. The womb, theoretically speaking, okay, I talk like man, I talk now like a man. You understand? I understand. I also want to get feelings concerning this. But if you talk and rationally, the womb not only an organ with the tooth picking. You know, they produce non-hormone. The side outside the hormone they produce, now the ovary them, the side outside the egg store. Now the hormone that they produce. So if they pull your uterus, that means okay, you know we get picking, they get other ways them where they forget picking where kind of Africa, they don't can talk much about that again. So okay, see for instance, they can take your egg, then they fertilize you egg, and then you give another woman, the other woman can born the picking for you, but then they are different egg and then they talk about it. But we prevent death. And then the women therefore understand. If you lose your uterus, yeah, you're not going to forget Bẹtẹ, but actually we prevent death. So that means if anybody don't reach that stage day where it get that kind big uterus day, please, please, please go to a specialist, go to a doctor.
Thank you.
You're welcome.
Thank you very much, Dr. Bell. I will go to Winifred.
Hello, good evening.
Good evening, how are you?
I'm fine. This is the book of Dr. Bell. You've already don't answer waiting I be want ask. But when you suffer from such, because like I'm a victim, when they go take you to the theater for do the womb x-ray after so many bleeding, non-stop bleeding, you're a doctor, you know what I mean, non-stop bleeding, you can't stand on bed, you can't do anything. Then you go into the theater, made them do womb x-ray. Waiting at the causeway, when they put whatever inside, you just see the womb so white. I don't know if we sabi fuk, like when you turn boil water, and that fuk, it is white, you know. And then at the end of the day, like you say, you get for loss the uterus. Okay, now you don't lost the uterus. Is there any the uterus don't go, but the ovaries are there sometimes? Because I know say sometimes both the ovaries and the uterus can be gone. Yeah. I know I stand to be corrected. Okay, so after that. You get for go through this process for get yourself being a woman again, get your feelings again. Is there any way, I mean, people you can able advice for somebody for go through that process? Because it's really a process. It's very difficult. It's like you are losing your mind, you are losing everything, if I'm right, you know. So that's my question. Thank you.
Yes, thank you very much for the question. Yes, it is traumatic. I mean, and they definitely we know that. You get for not only do all the medical side, sometimes you need psychological support as well in all areas. I mean, if you listen, we talk on endometriosis, like the same thing. You know, and if you listen to talk on breast cancer, and the same thing, you need psychological support as well. And within women, have also know is that you have for actually console the woman and tell her and say, okay, we know it's trauma, it's a trauma, but you are still a woman. You are still a woman. You still get, and the ovaries, if not only fibroid they inside, and the fibroid in the pool, they don't get non-reason for pull your ovaries. Yeah, because the ovaries still need for produce estrogen, I mean, you know, because if they pull your ovaries, they straight away push that woman into the menopause. You know, so and if you know that stage they hit, you know, if that menopause stage they hit, they not get non-reason if not fibroid, if not symptomatic fibroid operation where they get for pull the uterus, as I showed that 7.5 kilogram uterus, and if you get for pull them, you're not supposed, the gynecologist is not supposed for pull the ovary. I don't know if Salon get any support group, because at the other thing I always encourage people to forget support groups on. I think is one on endometriosis. I don't know if there's one on breast cancer, but it's always good for create them. They can group them. I don't know, especially if people that's Germany, for instance, then get them support groups then there as well. But places like I don't know if in the UK you can Google and find them support groups then, because it's always good for they in a group of women there we get the same, we get the same thing, we don't go through the operation, so we're not going to go through that. So we go able for even advise themselves as well, you know, and show people and say, okay, even if I'm not getting uterus, I'm still a woman. I'm still feeling like a woman. Yeah. At the end of the day, you still the function. They know they pull your vagina. Yeah, your vagina is still there. And then they get ways them way nowadays. Then if you need to pull the uterus, they need it, not even need for pull the cervix. The down part of the uterus, if that did not get more myoma, they actually pull that part there. And interestingly, so women them we left that part there, they can even see them bleeding periodically. Yeah, people then can say, no, even if you don't pull the uterus, you left that place there, you for do it and call ablatio for pull all the endometrium, the one with the one they did for pull and then that small part they were left. But some people they can say, no, well, if I just the myoma, they pull the uterus, you can left that part there, and some women they can still see periodically, will bleed like how they bleed first time, but it will still periodically see him bleeding, and then they can help them for the feeling for say, okay, I'm still a woman. What you get some other women then when they can gladly, because think about it, somebody when don't bleed profusely over and over again, they get the opportunity now, not forget, non-bleeding at all again. Some of them can actually tell God thank you.
All right. Thank you.
You're welcome.
Thank you very much, Dr. Bell. I'm glad the way you point them out that way as well, as in saying pros and cons, it just depends on the individual as to how, they will accept the entire. But one thing where you point out really very important, and then support group, a really important from a psychological perspective, more so for we really back home. There's a lot of stigma around some of the NTR because one, people don't understand waiting at the NTR. More quickly will begin put names to it. But if you get if you did a group where you got other people that really go through similar thing like you, or maybe don't go through similar thing like you, can help you for overcome some of your fear and educate you as well. I will go to iPad. I don't know what are the iPad. Please introduce yourself where you begin talk, please. Yeah? Is it Anne? iPad?
No.
Okay. Anita, can?
Hi, can you hear me?
Yeah.
Loud and clear. Welcome.
Thank you. Thank you very much, doctors, for the insightful, informative topic today. So I was diagnosed with several fibroids years ago, but I did manage to have a baby, but he was very premature.
Yeah.
Low birth weight as well when he was born. So now they've decided to do, I think, embolization, if I'm not mistaken. The one that I think it shoots the cells and stuff. I'm not a medical doctor, but it's supposed to shrink the fibroids. So I've got two questions. The first one being, what are my chances of having another preterm baby if I'm to have another baby? And then also, would you recommend to try for a baby before I get the procedure done or after getting the procedure done? Because I'm in my 30s now and I'm getting a bit worried. Yeah. So those are my two questions. Thank you.
Okay. I'll still continue for talking KRIO if that's okay, for make other people understand. Or do you understand? Do you understand KRIO? I guess so.
I'm really struggling, but just about. I can just about make out the conversation.
Okay,
so I'm doing okay at the moment.
I will
do it in English, please, for our benefit.
I will make an exception. So yeah, it depends on the size of the fibroid. Yeah, I don't know.
Very big. They're massive. Mine at about 12, I think. I think the
12
biggest one is about 12 centimeters. Yeah.
And why don't you want to undergo an operation?
No, I do. They've suggested to have the embolization, the one that's I think it cuts down the supply or something. That's what they were explaining. They'll insert something to cut the supply.
I don't want to yeah, as Mr. Fuller just said earlier on, we don't want to give personal advice here.
Yeah. Okay.
But on this program, but if you want to talk about that personally later on. But for me, one thing I would say generally is that if you want to be pregnant and you have fibroids that are over 5 centimeters, they have to go. At least the big ones, they have to go, especially if they bulge into the womb.
Yes,
they have to go. And as I said, doctors, we all have different opinions, we have different standpoints, and different reasons why we would recommend different treatments. But theoretically speaking, my assessment is that if you have a fibroid bigger than 5 centimeters on a woman who wants to get pregnant, that bulges into the uterus, that has to go. Okay.
Yeah, okay. So I was advised that if they sort of go ahead with the procedure as well, that I'm at risk of like losing everything. So I've got to sign a consent form to say if for whatever reason we go through the womb, that I will have to have like the full hysterectomy done.
Yeah, that can also happen when the embolization. That could also happen if you do the embolization, and if you do the embolization, that could also might shrink the fibroid, and if it shrinks the fibroid, it's still there, and if it degenerates, and that area of degeneration is also a weak area for the uterus. I don't know. As I said, personal advice here is kind of really difficult. To go
understand.
I've provided her the information she needs to get in touch. And,
Okay. Thank you very much. Thank you.
You're welcome.
Septina.
Thank you. So I missed part of it. So if you've already answered this question, thank you. I will try to talk my KRIO for the benefit of everybody. So my question, really, now the world is very small, so we get a lot of Chinese people already come, we part of the world, and then they bring their own ideology in terms of homeopathy, their own traditional Chinese medicine. Have you seen an increase or uptick in influencing how we treat fibroids, them based on their influence, like acupuncture, those kind of things? And if so, we know, and on the studies that we sent out, very particular to African people, but I'm wondering if there's any link to the herbs that we would eat, like tea or whatever we get, all that thing that we get, what we can take. If they have any, you have any studies where show say they increase risk for get certain fibroids and forget fibroids and so on and so on. And also we talk about generally some diet modification, but I'm wondering, if that's also being considered, those two things. So Chinese influence, the first one, in their own treatment modality. And then the second part of it now, like what we all kind of roots them, we not going to know, like a way you say ignorance, we the eat them, we don't say that, and also the probably calls, because we do have, it seems like a lot of Africans can get thyroid. So if you can shed some light on that, if you have any recent studies, stuff like that, just kind of how you think of this, those 2 points. Thank you.
Fatima, are you there? You can handle this one.
Thank you. I not be able to unmute. So at the moment, the majority of the studied and the pinpoint the Mediterranean diet as the most effective one where they're able to manage the growth. Sorry, is it okay if I speak English with you? Should I speak English, or I don't know, before I carry on? Okay, you're fine. So that other people understand as well, even though my KRIO is not that great. But yeah, so beaucoup of the research in the Mediterranean diets neither in the focus pan mostly. So it really difficult for understand within the the African diets that contribute to this fibroid growth than the problem. So I think say it really now something where it need research to see whether particular have them or particular food them where they are the African diet they contribute to maybe the development of the fibroids, maybe potentially, or they also the make the growth of the fibroid accelerate as well. So sometimes na down the back. But the Mediterranean diet, although it quite similar to the African diet in respect, with the eat beaucoup vegetable, the plasas mainly vegetable, unless you go add beaucoup meats them way get high saturated fats and so on, and the oil them way they use if they fry the kind of methods way they use for increase sometimes the fats by the food and so on. But generally speaking, the Mediterranean diet and the African diets then get similarities. So sometimes if they eat the basic kind of whole food diets where the African diets get, so not get any processed foods panam, all things they come from the ground, specifically when you're in a salon, then you go able for get that really high quality diet of specifically antioxidant vitamins where they put beaucoup of the fruits and where we get then a salon and Africa as a whole. So it really difficult for draw kind of the comparisons, but I think say we therefore get beaucoup research where we therefore do the food them way sometimes now we diet where they contribute to the fibroids. So now then the normal go able for give you as information. Thank you.
Concerning the Chinese area, I've not know any studies them way they show say their own, and also there are some things then they advise people when they can recommend for make people then do, but for me I'm more on the lifestyle area, relaxation and anything. But I don't know any study the way they show say I don't know, things like acupuncture they reduce the size of fibroids.
Oh, sorry. The other thing will be one for other things. Say now where say the food them where I am soy and I'm on the Asian kind of diets, so like tofu and things like so. Now then they eat on more than past we, so we not get too much trouble in the sense that we they eat beaucoup soy food them, but sometimes some of the African food them way we they eat then still contain soy,
Yeah.
Yeah.
No, Septima, we asked earlier on if we know if anybody's way about acupuncture, any Chinese medicine, them way they help for fibroids, but I don't know of any.
Thank you, Uncle.
Okay, thank you very much. I don't know, Septima, I still want to ask a question?
Well, yeah, so follow up to that. So my follow-up question and is also depression. I don't know if you addressed that. We in Africa, we never really discuss depression, and almost we get a kind of negative connotation or attachment to depression. And I'm wondering, as part of you, we will, it's a long kind of within the DSM when we categorize all type of treat, we then include that depression as part of the normal standard, right? For make sure they don't miss that symptom day. Because of course, the person will be born, that's alone a problem for the maridos, that kind of thing. So I'm wondering if that's something they see more of now, where people may talk more openly, or if there's something we still know they talk about, or how do they approach an asylum specifically Salome, because you know, say the Westerners then take care of that part. But now Salome, we are concerned about, if you don't mind.
Yeah.
Shed some light. Anybody within a Salome, shed some light. Thank you.
Yeah, if Miss just say a few words to that. I'm not in a salon, but I don't hear stories and stories before of women and we really go into depression and suicidal also because we forget speaking. And yeah, it's in Africa, it's a big problem, and people they address that area there as well. Not it depends on which age you they address some people that can think say, oh, if I go to psychologists or psychiatrists, and people then go really look me funny, then it's still in Sierra Leone. You know, this mental health, where I can always say, I mean, the way how you go to doctor for me, you go check your blood pressure and check you sugar. The same way we get mental issues, we get mental health issues. I mean, also for people that can always create, can always associate mental health with Christmas, you know, and that is really wrong. It makes sense, you know. So and yeah, Auntie Ruby might aim for talk more about that stuff because it is a big problem, and creating self-help groups, that's very effective. You know, and if you did get like-minded people there when they sit down and they discuss them there, so you know, definitely I could always recommend like the doctors them for connect patients them. Okay, you get doctor patient confidentiality, so it can difficult for say, okay, you want like give this patient here your name, so now make you get for ask. You ask the patient, say, well, I get this other patient. You ask the one first. The one say yes, you can give me name to anybody. They ask. They ask now. They talk. Say, okay, well, it's not that difficult for create such a group. You know, you just need the one person first. You need the one, and sometimes you also need the help of the doctor. You ask the doctor. The doctor will ask. I mean, you mind for create such a group, and if there was one patient say no, I don't mind. You know, the next one when they come with us can say, Asabi somebody, we want to create this kind of group here. So you mind for make it contact you. And if you say no, you can. So it's like the doctors themselves also gets a big role for play, for bringing them patients then they together, for making them able for create such a group, for making them able for help each other. Because people like always feel say we doctors then be able for the whole thing. You know, I can meet something that I can go somewhere and say, no, Dr. Bell, somebody can ask me and say, I get back pain. Or me foot the heart. I say, not that kind of doctor, maybe. You understand? So you have specialists for the areas in there as well. But at the end of the day, the doctors then can actually able to bring patients then together for make them able to help themselves. And I don't know if that really happen at Sierra Leone at the moment.
I think you want to add to it, Dr. Bell?
Yeah. Just according to what Dr. Bell say. Now, what I'm going to say is, you talk something as well for say, even with endometriosis and any health issue, there's always going to be a mental health problem at the back of it, anxiety, depression, and like Salonso, we don't know. Sometimes we don't know how for support that person there or that family there. We're very, very difficult. That person is going to go through your own difficulty, your own depression and anxiety, plus an issue we get. Now, so obviously, mental health very, very big. Now, in past 2 years now, now the main topic. You understand? So you not just get for be schizophrenia, you not get for be bipolar affective disorder. Just where something they happen to you, that trauma where they happen to you, especially like if woman they try for born, you know, for born, they see in Bele the big, and we don't get the end story. Then they boku where do man in Bele, tima param, he say get Bele, it don't get Bele for 9 months, 12 months. So sometimes you wonder because we know for say most Bele woman the way they get Bele, well naturally na 9-10 months, the Bele go last for. But for like woman get Bele take 12 months, and only for go find out for say na fibroid they get. It go worry for say if then they go do operation again, like you say, then go take in womb out and all that stuff. Then they so boku group then they Dr. Bell, just like you say now one green person I get for start something. I think we get maybe that bit of understanding as well. We can something working for introduce because it's difficult for like anybody go can start something, but if you get that one person, we go say, okay, the law can talk about it. But because of the taboo in Africa as well, even in Africa, not the same thing. For like people and talk about things, them it's difficult. So yeah, so the confidentiality all is the group is there already. All you get for do is, do you want me to lag you the number? Let you call that group. This one not to me get for do I against for you. Now you don't do it now, you don't get the number for call the person. So that I don't cover that confidentiality there for say I don't give you name to person. So it's I think we just get for come together, or we just get for continuously desensitize people them for like group, then they come up and then we talk about mental health as well. Not of us we say mental health, not that bad mental health. It's just that the stress way they cause people and get for take down, they are aware of it all the time for say for every problem where we get, there's always going to be anxiety, depression, and other stressors them. So mental health, no, they come out, but none of them anything where anybody to go through. So now that's no matter for say. Thank you.
So one short thing I want to say, we get this group here so well, Bɔdi Bεtẹ past Gentri, you know. So if we get people in where they suffer from fibroid, and the one gets together on a contact with group, yeah, contact with group. You get your email address. Mr. Fuller go give you the email address again. Contact the group. They will go in for connect now. You know, yeah. I mean, even if on a different side of the world, if not Sierra Leone women, they come together and then decide, okay, let we create something, and then we raise up the awareness. We raise up the awareness na salon for get more people in a salon for joining that group. Then itself will be wise. You know, so if una then at the group, una don't already stop here, so una think say it go wise for make una create a group. As we're going to talk about a group, we don't need for be 10, 15, 20 people then. If now wanna start with 2 or 3, you know, by the time you go salon when I spread this word there, so when I will get more people then, and when I go definitely be help to each other, you know, and me not even mind for support that kind of group day. Yeah.
Yeah. And not just that, not another way for desensitize people them as well, or sensitize people them for say, oh, okay, then this year's why they go through not so many one grain. So now so many people them, they go through the same thing, because all man they keep in your secret. You they forget for go tell anybody for say that this they happen to me, I they overbleed, or I never forget picking and this and that. But if you know for say una gets that group, then people and they, oh my God, I don't know for so many people and they go through the same thing. You know, now the more people and go find out what thing they go on, and now the more other different group then go happen for cancer, for anything else where they happen to people, because now just one group, one thing number for start where I suppose it go make the other people themselves come on board as well.
Yeah.
Well, thank you very much. Unfortunately, the last question, Violet, will get for taken from. We really don't go way over time. We're glad to see people that ask a lot of questions. You should see when I'm interested in the topic, you know, a good, the presentation good. But unfortunately, any good thing will go for counter. So Violet, you go with the last question for today, please. Violet, you mute yourself, please.
Yes, good evening.
Hello.
Yeah. I'm so happy and feel blessed for come across the link. As this is through Muriel, we get a group on nutrition where I join. So as I come out church, I see the link. I just start for login. I don't listen the explanation, the advice from Dr. Bell. Me na fibroid victim. 2012, I undergo fibroid operation. Before I do the operation, it's like I've been so scared. You know, my mommy na been medical somebody, then I tell them say na this doctor say, and if I not be get stomach ache where I go hospital, then do ultrasound, then not me for no say I get fibroid. So one thing, a good way let people and they go hospital and they do check up. So now through that way, the doctor able for detect them, then and I be multiple fibroid. I mean, get for say, well, this is to get for remove them. Oh, I've been feel so depressed, you know. I've been so young at that age, 28 about, yeah. So I say, wow. I begin read about this thing. Me for can go do operation. I tell my mommy, hey, Allah, oh, don't kill me. You can't think this, don't kill me. So like I keep quiet. I've been there for the pray. They say it came to a point where I dream, say I do the operation, it's successful. I grab, I go about my business, I go arrange with doctor. I not say thing, I not tell me mommy, I go under the operation. It was successful. Then just 4 months. And before I go under the operation, then my husband don't propose to me. So we don't get like 1 year, 6 months time period for getting married. But I don't read about this fibroid. I don't see say now something where they regrow. I begin say, me they do operation now, then I can married after 1 year or 1 year, some months. In case it can grow now, then I no can able born again. I don't marry. So that's we make I take some decision way. As do me operation, I try for check how long it take for heal up. 4 months to 5 months, I get pregnant. And doctor be even show me patient them, like for give me courage. He say, not afraid. Show me patient them. Say this woman been get I do he don't born. So like I born my first girl 2013. So I do the operation 2012, August, 2013, September, I give birth to a girl, CS. Then 2015, just 11 months after, I take in again and get the second pregnancy for the second girl, 2015, again, another CS. So it's like, I don't do 2 CS, 1 fibroid. Then don't big now. Then I say, okay, I need to get another baby. I begin to experience bleeding, like in the period. The first 2 days getting so heavy. Times I can get for go faint. If I can get for go out when after a longer time, I'll get for go faint, use 2 or 3 pads, or even I can say this pass I use Pampers, it came on me. So I go hospital again. Then because my foot been they swell, I'm the first now I study. I go to doctor, then check me, then check again, say, okay, get put in a urine, put me on medication. I go on down there as well. Then I experience some infection, yeast infection. And they treat me still they happen. But my mind, they tell me, say, what if this, there's something where they press me down where they cause this infection? Maybe not to toilet or they use or not to anything. So when I don't hear we doctor don't express it can cause infection, because if you press you to your bladder also, or it make I don't understand that. But my foot's not the swell again. Then they be numb, cut off because I try for watch on the weight. I don't they check my diet now. They eat more of greens, especially in the morning. So I do my ultrasound. Doctor say I get 3 fibroids. The one way big na 7 centimeter. Then the other 2, I think na 2 centimeter and about 3 centimeter. So he asked if I get for born back. I say yes. So he said, okay, well, let me see if you could get the chance for taking, because I said, okay, so now that I day on, because I'm not on any medication. Say, okay, if you take this for like shrink arm or do this, I say, okay, let's try and see if I can get pregnant. Because I don't go under 3 operations now. Myself tired. I don't want to operation again. So I get for decide whether I get for give birth again, or if I don't give birth, then get for use that way for shrink arm till I go to reach menopause. So now my own testimony that on fibroid. I don't know advice where I go get formula.
Well, thank you very much for that testimony there. I mean, for sure, the one main thing for sure women is say yes, you can young and get them. As I said, we don't show that picture of the 27-year-old woman. We get a baby, get a multiple baby fibroid them. Yes, but you did also show say it's success. The operation was successful. You're able for born 2 picking there, and that's really good. We always know say you always get sidebar now. The studies don't show say women they're waiting on being reach their age then 38, 39 going to 40. They can always think say the term for make her get pregnant they can't done. So thinking want to get pregnant back. We don't see that a lot. Say women at that age, they especially we don't get 2-3 picking, and when they picking a big small back, they're not come at that age where the mama get for nurse them. They can always get that feeling, so oh, I need for nurse another picking. So they can always one for get picking back. That is the psychological side that they talk about so now. So for able for convince women, especially around that 10 day, for saying, you don't get too healthy picking them. You know, things say it advisable for get a third one. It's very difficult. You know, you get forget the nice way they ever talk to that woman day, especially on the psychological side for making convince and say, at least for advice and say, yes, forget pregnant, a wonderful thing. I make the work in that area day. But also if you don't get 2 picking, you don't get 3 operation na uterus, you get for really consider if you want to get a 3rd operation, because definitely the 3rd one get for basic section back. And also that means if the risk for making the uterus rupture during pregnancy also high. So yeah, there are studies where they show say the risk high, but it's I mean not to say it will happen. Your gynecologists get for make sure say get for look you and control you during and check you during the pregnancy until you're born, and it's going to be a cesarean section again. So, but in your stage, when you get a fibroid with which it says 12 centimeters, okay, we don't know who side that fibroid they yeah, we have to say then different number then from 0 to 7. Yeah, if not 7, it's not supposed to affect your pregnancy at all. But it can still grow during the pregnancy. And if you don't get a 12 centimeter fibroid, yeah, then it can grow during the pregnancy. And not only that, if you don't even get pregnant, you left and so, especially when you're reaching menopause still, it can still continue for grow. So that means in your own stage right now, as I say, me not to God, me not go tell woman say you not supposed to get pregnant, but I advise, yeah. Your advice could say you get 2 wonderful picking. I believe say you get a wonderful husband. They hope so you get 100. So I'm say you family kind of almost perfect. Yeah, waiting this next picking go benefit you, especially where you go into a lot of risk. So then they get for sit down and consider that day. Yeah, and so if you decide finally say, okay, I now want to begin, I will still advise you for at least take that contraceptive, we go reduce the fibroid or at least not make it continue for grow, because it can still continue for grow and cause problem later on. But if the fibroid is so big that now it actually cause the swelling of your foot, because that not means that it not means that it cause the swelling of your foot too. I don't know, you almost your BMI, I don't know, you heart condition, because all that can cause swelling of your foot. But at the end of the day, I will always advise women them in your own situation, firstly, not forget pregnant. Secondly, go regularly to your gynecologist when you can check you. And thirdly, if it's too big, we don't cause symptoms, heavy bleeding, start for see if with the contraceptives, with the progesterone, or with the IUD, if it will help. If you know they help, then you go for go through operation for at least make sure say you know go into anemia where you will need blood or something like that. That will be your advice.
Yeah, we found them. Well, I thank you for the patience and everything. And for the man they reading our missed. Well, I thank you very much. We want to join because it's good for learning, like I said before. but we demand them land, but then so we know exactly what the woman they go through, how we able to support them. In case it come closer to home, we understand, at least we will show some empathy in how they feel. But unfortunately, we family we don't come to an end. Everything good thing will come to an end. I will ask the people at the panel one day, the doctors are ready. If they want to say any final word, if they don't want to say any final word, then Dr. Bell, you can say the final word, then we'll finish for today. But we also get Dr. Kamara, Auntie Wugi, Dr. Toure, Dr. Rashid Conte, Angela Ansu Fatima. So if any of them want to say anything final, please unmute yourself and I say, if not, Dr. Bell, you get any final word for people there? As a take-home message?
Yes, well, let us listen to the other. Now, want to say anything from the panel?
Silence means they're all right.
Oh, yes. Hello.
Welcome,
the prodigal son. Thank you very much, Dr. Bell. This is a very, very important presentation. And we know, say, Boku with family they are affected. I don't know, maybe we're still lacking with the advertisement or, getting more people on board. So I don't know, I want to suggest, say, for them kind of people where they affect many people, perhaps for make a repeat presentation, maybe in another 2-3 months. It's just my opinion. But otherwise, thank you very much, and Auntie Fatima, for your contribution.
Thank you very much, Dr. Rashid. I want to thing that we think about, and I told we don't discuss, but we'll take them offline. It's about coming up with short clips, few seconds, maybe a minute or two videos, then we'll bring out, but that's not two we'll work on. That's what we don't discuss. But thank you very much for the suggestion. Anybody else they want to give them final word from the panel? Okay, Dr. Bell, you can give a final message, then we will go home. People really don't show patience today.
Yes. I mean, people also, it's people are still there on, and that's really, really good. Thank you all for on idea. It's happy for giving this talk also because it's very, very important. I talk about Barongi from Tem, but I'm glad it's Barongi now. And please, I know say this is a very sensitive topic. This for a lot of women. Them, I don't, why make this year so also they close to my heart because I don't lost people because of this. I know at least of 2 people that were lost because of this topic here. So it's very, very important for me to go see a doctor. I mean, not take this thing so lightly. If a small fibroid they wanna get, then I understand. As I said, the watch and wait is okay, but the fibroid are not big, they're not really big. You get multiple fibroid, and we don't begin get symptoms. You get a heavy bleeding. As I say, sometimes your body they acclimatize, they adjust to that heavy bleeding there. So they feel nothing. So you reach that point where you don't so critical, where your body not able again. Now you get that problem. The way some women they need blood, and say blood, especially in our country like a salon, we not know how waiting and call and we are different topic than they. But most women or all women where they die because of fibroid, not because of the complications of fibroid. So please, yes, if you lost your womb, you still not woman. Yeah, especially when you don't reach the age over 40, you don't get 2-3 picking them. It better for me you lost that womb day than you lost your life. You left them picking them behind. Then they not go fine. Yeah, the one they will not get picking, then they're young, then get fibroid, let them go see them specialists, especially go advise them for maybe put them fibroid. If they wait too long, it got too big, that thing then now you will lose your uterus because the fibroid are too big. And that's something we need to talk about 2, 3, 4, 5 weeks or months. We talk about like then 3, 4, 5 years. I think they grow that kind of way. So please. And then as I say, for the self-help group, if you want, una contact we na well Bɔdi Bɛtɛ plus Gentri, and we can help una create a group, and as I say, myself willing for support that kind of group there. Yeah. Tell una thank you.
Yeah. Thank you very much, everybody. As the advice today, dear, with the big una follow the tips and hints where they don't give. Like Dr. Bell say, if anybody gets anything personal and we want to reach out on, we don't get the contact details. I want to thank you very much for our patience to the Muslim them. I know say we will not be in day during Ramadan. Eid Mubarak, and we tell on all plenty thank you. And so we all the Sierra Leoneans independence. Till we meet again.
Yeah.
Well, Gentri. Good night.
Good night.
Good night.
There we go.